the activities of the lab, and also some cases like co-creation activities that we do that Maria will present in many different projects, but also how we work on the social innovation and responsible research innovation that Tesfina Manjeri will present. Then I will present the overview of the Vitalize project, and then Despina Pechani will explain how other living labs out of the consortium, but living labs that contribute to the shaping of the living labs and of the harmonization of the activities of the living labs can be engaged in the project. So I will give the floor to Maria, and once Panos connects, we will follow up with, he will have the next presentation. From my point, it would be nice if you want to interrupt us and discuss if you find something interesting while we present. Maria?
Hi, everyone. Good morning. I'm glad to see you. I'm sorry you cannot see me because for some reason my camera fails to start, and that's bad because I've put on a lipstick today after a few months. Anyway, I will share my screen. Okay, so I haven't prepared introductory slides for the Lab of Medical Physics, but Thessaloniki Active and Healthy Aging Living Lab is hosted by the Lab of Medical Physics at the School of Medicine, Aristotle University of Thessaloniki, where we have various research teams, and we are hosting the Living Lab. But it's not just the Living Lab, it's the Living Lab is focused on the active and healthy aging domain. So we are organizing several co-creation and co-design activities to improve the quality of life and independent living. The main infrastructure is hosted here in our lab, but we also have a new transition living lab in a hospital, which is connected to the medical school And the Living Lab is a hub of multiple actors between academia, research centers, the industry, civil society, and policymakers, and it's part of many European partnerships. The methodology that we follow is mainly on agile development. So we have several projects, recent projects, among which is Captain and Syscode, in which we follow the agile methodology, where we host several activities on setting requirements and design and the design thinking methodology in order to develop and test and deploy and again review and follow the same path again. So we have committed to actively involve all the interested and different stakeholders in all steps of new solutions. This is our team, and it's not just these people, it's obviously many more because we are running more than 30 or 35 funded projects at the moment in the lab. And we run several co-creation experiments or pilots. And these are those that are connected to active and healthy aging and silver science. But we've also have different activities like focusing on medical education, where we co-create educational resources together with students. For example, when we design and develop mixed reality educational resources, or XR games, we also have the involvement of students or health professionals in order to create the resources. Among our activities, one of our main achievements is the initiation of the collaboration and research community for independent living, where we have invited more than 70 older adults, which we face as collaborators of the Active and Healthy Aging Living Lab, who participate in research and social innovation activities, providing experience, requirements, ideas, and feedback. And this is the topic of, this is what I will present today. The people that have been engaged in working with us, they have worked on a Captain project, but also on CISCOT, where they faced, we set a challenge to enhance active citizenship and tackle the risk of ageism in the aging population and chronic patients by introducing a lifelong learning program for early stage developers. So we tried to combine the ageism and cultural stigma and open science, social research, and co-creation. And to do that, we have set 3 research groups on active citizens, environment, health, and social welfare. And they had each group, they had their own mentor. And we have applied scientific research methodologies in order to address everyday living challenges for the people, older adults. This is a slide demonstrating the Open Living Lab Days, activities in the Open Living Lab Days, and the involvement of the community of older adults. And we have linked the community with policy making in several panel sessions. The activities that we start with usually are design thinking sessions, where we invite in several locations the people forming the stakeholders community, where we have initiated activities on co-design and creating the ideas, validating concepts, and explore the research problem in every case. So these are various locations and various meetings that we had with the community. The problem here is that I cannot really see full slides. So we had several visits, educational visits with the older adults. We've invited them to visit the library and also the medical school. In the library, we introduced some research topics. So we tried to link the older adults with the academia. And we guided them how to actually research on a specific topic that we had set. And we've also invited and linked the community with some courses in medical education. So Panos courses were combined, let's say, with presentations of students on specific topics and the active involvement of the stakeholders community of older adults. We've also had hosted several meetings in cultural places, and these were entertaining visits, but we always tried to combine some activities that could take place for the community in museums, in galleries and technology parks. So we've visited the concert hall, the Museum of Photography in Thessaloniki, a cast museum which is hosted within Aristotle University, and the planetarium. So these were activities that were highly appreciated by the community of older adults, but they've also contributed to achieving our research goals each time. We've also organized some outdoor activities taking place in parks, in coffee shops. We've organized excursions or picnics, again with having a specific scope and trying to combine our research activities with the place that we visited. And we have also some seasonal events that we've organized, like Christmas fests, where we've invited them to meet them and to exchange wishes, for example, in Christmas period. But also to create some seasonal, to do some seasonal activities. And we've also, we take part in marathons where we, the local marathons which are limited in length. So we invite also the stakeholders community of older adults to take part as members of our team. And suddenly we had COVID-19, which actually stopped us from having all these kind of activities. Therefore, we tried to organize some alternative activities. And we hosted some e-coffee sessions. We started with telephone conversations and, calling people one by one to see how they were doing, and then organizing some e-coffee sessions and online co-creation activities using Miro or Mural only for the people that could actually compete, not compete, but perform these activities. Of course, for some people, only other social media were available because they are over 60, so they are not all familiar with all kinds of social media. But we've managed to have them, to have some contact with them. And they are all looking forward to meeting us again in person when the pandemic permits. That's all. I think these are the activities that I wanted to present. So my colleague Despina Mangiari will also discuss more on how we have managed to engage these people and manage their participation using several tools that we have developed here at the lab. I'm not sure how, if you have any questions, please go ahead, and or we can proceed to the next presentation.
So would you like questions now, or I know that Panos is here and I think we've got him for a limited time.
As you wish. I mean, you don't. You will have more information from Panos on more global information, let's say, on our activities from Panos' presentation, and some more details from Despina Mangieri later on.
Gareth, I see that the one question that we have in the chat, which is about the 3,500 projects, Panos is the right person to give an answer.
Okay, Diego, you have your hand up. So we might just take one question from you now, and then I'll encourage people to put things in the chat. We'll go to Panos because I know we don't have him for very long, and then we'll come back.
Thank you, Maria, for the presentation. I wanted to ask about the COVID-19 measures that you have taken and how people have engaged with the online sessions, for example, the e-coffee sessions. Have you seen, like, how were the initial reactions to those online methods, and have you seen any improvement over time on engagement?
These were minimum measures in order to retain their attention and their engagement. It's not easy because there are several technical difficulties because we are talking about elderly people in Greece and they are not very familiar with all the online tools and social media. However, there are some groups among them. I mean, those that are in Facebook, for example, are connected through Facebook, so we managed to contact them through Messenger. For some others, we've set up Skype calls, and for some people who are around 80 years old, we've used phone calls. But I think they really appreciated our efforts in keeping contact with them. And we do that every 2-3 months. We try to contact them and just state that we are here and we'll meet again when we can.
Thank you. Thank you. And I'll just encourage everyone to keep putting these questions in chat. That was a great presentation. Thank you. And I've certainly got some extra questions for afterwards as well. But what I'd like to do is introduce and then hand over to Panos Bamidis, who's the Professor of Medical Physics, Medical Informatics and Medical Education at the University of Aristotle and is the head of the Lab for Medical Physics. Also a long-time supporter of the Living Lab as part of that. He's also a visiting professor at the University of Leeds at the Leeds Institute of Medical Education, and also is very much in demand. So I know we've only got him for 10 to 12 minutes. So I'd just like to hand over and welcome and hand over to Panos for your presentation. Thank you.
Thank you, Gareth. Apologies for joining late, but I was trying to park actually because on Mondays since everybody's popping in. So anyway, we are trying to get back to normal, as you can understand, but it's been done in a very slow way, I guess. Anyway, thank you for the introductions and thanks for the organization of this meeting. I think we know bits and pieces from each other, but it would be nice to have the overall picture put together. So the Lab of Medical Physics, where we are based in the School of Medicine, is now renamed into the Lab of Medical Physics and Digital Innovation, so that it can embrace more of the activities, most of the activities that we are doing. Well, the Living Lab has been functioning since 2013 or 14, in essence, when we first established some of the physical spaces that we still use today, and we continuously using them and copying them actually. So regarding the lab per se, it was one of the first labs in around the region, founded in 1964. And we have been, we moved here actually something like 8 years ago, 9 years ago, when we were based in a different lab, but we moved in this lab and completely transformed the essence and the everyday activities of the lab. So apart from the training, we are trying to do complete multidisciplinary research, and the vision that we have in all projects is that we try to sustain the outcomes. So we wouldn't like to let the project that finishes just disappear, and the results or any outcomes that the project has produced to evaporate and dissolve basically completely. We try to keep them on, exploit them in some way. So that's how we try to see each of the projects that we're running in each of these fields that you see here. We are very active in assistive technologies, but also technologies for medical or health education per se, applied neuroscience, etc., and all these groups. We do have a sort of a group of people that have common activities and projects. Some of the research groups is the active and healthy aging and silver science group. There is also a group on neuroscience, as I mentioned. We call it neuroscience of cognition and affection, medical education, informatics, innovation, technology, empowered learning, etc. But we also have more unique ones like the biomedical engineering and aerospace neuroscience group, or the medical robotics group, etc. We are one of the few groups in the university having 2 ISOs. The first one is 9001 on activities that we develop software, but also the activities that involve training. And recent achievement is our 484 ISO on developing specific software as medical software for physical and cognitive empowerment. We are probably the biggest group now in the university if we count on the number of people that are employed and work on the different activities, research activities in the group. Counting something like 50 to 60 members, both permanent staff as well as contract-based staff. So the Living Lab, we call it still Thess-AHALL Living Lab. It's an effective member and the task force leader for health and well-being living labs. But we also coordinate activities within the European Union City Science Initiative, coordinating the city on mental health and well-being actions and trying to involve now, transform what we have been doing previously in a mission. We are also a 2-star reference site for what's called the European Innovation Partnership on Active and Healthy Aging, probably the only reference site that is bilateral between countries. So we operate both in Greece and Cyprus, in fact. And we do have commercial uptakes from these activities. This is part of the achievement for exploitation of projects. So one of the first projects that we have been coordinating back in 2009, 2012, ended up in building this reference site and the ecosystem. So basically giving software and services to the community so that we can promote active and healthy aging. And we do operate it still under a self-funded initiative from the university, like a spin-off, but it's not a proper spin-off. But the proper spin-off came out of another project, and it's called Captain coach. It's a project that finishes this month, well, next month, in fact. This is still May today. So end of June, we are finishing the Captain project. And one of the spin-offs that has been developed within the realm of the Captain project is Captain Coach. We have a memorandum of understandings with many patient associations and local authorities and networks like the Hellenic Intermunicipal Network for Healthy Cities, which also cooperates with the World Health Organization in regards to health promotion within the municipalities, and the collaboration community that has been also mentioned by Maria. It's functioning for the last 3 years. We have unique dedicated spaces for neuroscience, but also infrastructures unique. I'll try to show this, and a number of other professional societies and scientific organizations. We try to record data, facilitate the recording and the collection of data in many of the activities that we do. But our emphasis is to understand with different scientific methodology what this data mean for us, for the society, for the professionals involved, for the citizens, etc. So I like saying that the next big thing after big data is understanding what they mean actually, and this is what we focus on, trying to solve different key human or societal problems like aging, cognitive impairment or depression, cancer also, neurodegenerative diseases in general, Parkinson's and multiple sclerosis, but also more specific things like problems that our society is faced with, like epilepsy, accidents and spinal cord injuries, chronic pain, sleep and apnea, etc. Some of these relate also to the COVID problems that we have been all faced with. And we try to develop for all these, not only collect data, but also develop intervention approaches, software or other means that can intervene and improve something, so have an effect basically. So key infrastructure that has been mentioned is one of the living lab spaces that we have active since 2014 essentially. It looks like a living room facilitated. It's a digital space where we do sessions, we do interventions, we measure things, we evaluate things, we co-create things. A copy of this is now trying to become a digital space because physically it has been established in a hospital, in a pathology clinic of the university, and we call it Healthcare Transitions Living Lab, in which we will basically trying to, apart from anything else, on co-creating or something or co-designing, also study healthcare transitions and independence self-independence of someone so that they can exit the hospital and go home or go into the rehabilitation home or something like that. We also have neuroscience lab, dedicated labs, back to back, in fact, from the living lab that we operate here is a neuroscience measuring lab. We utilize it as a sort of the data we collect there as biomarkers of the interventions we promote within the living lab. And we are now establishing an MEG lab and a magnetoencephalography lab, which seems very highly sophisticated, of course, and very contemporary. And it will be the first in its character, but we also try to pose human and societal problems that we will study with this very high-profile machine, like societal screening, or try to measure the status of people, health status, etc. Also, we have dedicated spaces like with a human centrifuge is a lab that we have established in a private rehabilitation home, but we're also now moving it to a hospital within the campus. It's a human centrifuge for rehabilitation, basically. So we try to utilize what NASA and ESA are doing for the rehabilitation of stays in the absence of gravity and counteract the effects with these activities. So I mentioned already the 2-star reference site for Greece and Cyprus. The patient community has been also mentioned by Maria. Our network actually spans throughout Greece at the moment and Cyprus, with many different communities and municipalities experimenting with us, but also exploiting the software and the services that we provide. Much of the activities, much of our research production is centered around vulnerable groups. So you see here a combination of 2 programs, in fact, a European project called Captain that I mentioned, which creates e-coaching solutions, and funded nationally funded project, Biotech Coach for All, which takes this solution and try to focus that in patients with cardiac problems and heart status problems. I mentioned the medical education. We have a unique capacity in trying to impose solutions on the healthcare professionals, our students. Also in there, we are trying to follow co-creation, co-design activities, at least, and try to see what is best organized to be promoted to the students and the medical professional community. We have a sustained track of receiving funding in, apologies for the slight Greek words here, but you can see since 2009, this is a partial list, in fact, of projects that we have been running that focus on technologies for medical education and health professionals training. Some glimpses of our work, our recent running work, a project funded by Horizon 2020 on palliative care. At the moment, we are trying to create mobile apps and virtual environments to assist patients and the final stages of their life, as well as their relatives. This is some of the apps that we develop here for everyday problems in a kind of virtual patient training activity. I don't have the videos for the virtual reality. We are showing them tomorrow, actually, in a project meeting. I mentioned cancer. This is our Life Champs project, which we coordinate at the European level. Is studying 3 types of cancer: breast cancer, prostate cancer, and skin cancer. And with everyday measurements that we will explore, that we will start in autumn, hopefully, we will try to record at least a year's data with these patients, experiential, subjective symptoms recordings, etc., and utilize it with any other digital biomarkers that we might have, so that we can improve their everyday life and the therapeutic interventions, perhaps. A project that we conclude, which is funded by Pfizer grants in the international scheme, is a project focusing on doctors' education and empowerment of patients regarding atrial fibrillation and venous thromboembolism. The material that we have created, to our surprise, is going to be utilized also for the COVID cases, especially vaccination, since there is much fuss these days about thrombosis, potential thrombosis, etc. So, although we started from a different perspective, this is going to be also utilized for a different scope nowadays, together with this project, which is also funded by Pfizer International Grants, and is for training and ubiquitous outreach regarding co-design of learning resources for the engagement of chronic disease patients, in specific with patients with low back pain and etc. Evdokimos will mention about the Vitalize, so I'll proceed that. This is a snapshot of the project that we have. In fact, last March, Despina organized a month for reporting a project every single day in social media. So all of our colleagues had to write something about their project for a day. And as you can understand, 31 days of March were occupied by each of these projects. None of the project was mentioned twice. Okay, so I think I'll stop here so that we have more time to discuss if anything arises, etc. So thank you for your attendance. I can reply to questions how we can combine medical and social care. That is the essence, Sonia, and nice to see you. For the establishing the living lab, in fact, within also the hospital, the healthcare transitions living lab. Basically, we take a medical problem, which is this person able to go home, which is a clinical question, so that they have to do different clinical tests, see the lab examinations, etc. But someone has to take care of them. So although they might be able to be released from the hospital and go home or go to somewhere else, there is a potential for dedicated questions on social care and how the relatives or other healthcare professional workers might take care of them. So the living lab space will provide us clues for what is to be, for example, taken into account while this person is released from the hospital, etc. We also try to utilize those spaces for engaging the clinical staff on different activities. So at the time being, we just ran a focus group last week on trying to see if the different actions and interventions on digital empowerment of patients can actually have an immediate application to the hospital environment, or it is something of a long shot and we should not consider it at the moment. So this is a couple of examples in which we try to combine a medical problem, but from a social care perspective. And also the systems and the services that we produce, most of them, we don't call them medical devices or medical software or service. We prefer to call them social care services and innovative social care provision attempts, because we mostly refer to establishments like a municipality health and social care center, or a daycare center where elderly people, for example, will go there, will utilize the software, and a non-medical person will take care of them, will note down their progress, and will consult with them. So that's part of the sort of activities that we try to combine the two services together.
Thanks a lot, Panos.
Thank you, Sonia.
Thank you. Andre.
Thank you very much, both of you, Panos and Maria. That was really interesting, actually. That was great. Thanks. So lots of questions, but maybe I can start at the end, which is the kind of evaluation of these programs and all of these little projects. How do you know that things work? How do you know that they work better than other ways? And I guess a sort of related question about sustainability of some of these things, but I'm interested in the evaluation piece.
Well, it's a multifaceted approach, I would say. I mean, it's we try to have evaluation perspectives from the clinical, of course, perspective, which is A, B, C, whether this has made a difference in, for example, the health or the cognitive status or the physical status, etc. So we have a number of test batteries with questionnaires or with measurements on testing that aspect. Then, of course, we have the approach on if it's a system, if it's useful, if it's sort of usable, etc. That refers mostly to the experiences of users, but also we do have, and this is probably the most interesting one, is how much it will provide to the society and the community. So the combined example, the combined outcome of how much in time will this project last, how long it will last. So basically how long we will sustain its activities and services is a provision of evidence that, okay, this has made something which is useful. But this, of course, you don't know in advance, okay? So we are at the moment trying to employ new methodologies and try to specifically predict that something will be sustained and will have value in the long run. We have seen some measures of these from these 10 years track record, and we have some sort of idea in our minds. But we are always at the investigation of new methodologies that will try to emphasize more on stabilizing these estimations, etc. So there are at least 2 or 3 PhDs at the moment running on trying to make sure that the evaluation process that we run during some of these interventions or activities will actually have a societal impact at the end of the day and therefore could be sustained. That's all I can say at the moment. I don't know if others want to add on this, Evdokimos or one Despina or the other Despina.
I would just add that for this we're trying to come up with, and this is part of the Vitalize project, to come up with KPIs, but on actionable metrics. So we try to understand the impact of what we do. So we compare it also with others, and we see which actions, activities, procedures increase the KPIs more. So we learn from each other, which is not, it's a challenge for us. We have tried to have actionable metrics here in our lab. This is why we discuss on what activities we do, and we try to understand the impact. So to link the activities with the impact, and to understand what which of the actions, activities, procedures create the highest impact.
Great, thank you. Phil, did you had a question in the chat as well that was related? Is there anything you'd like to expand on?
Yeah, look, thanks for those presentations and comments. So the conversation from Andrew around, what sort of evaluation stuff was similar to what I was asking, but I think the issue for me is probably a little bit further than that, that once that you've done the evaluation and you've got your results, how do you then intend to be able to scale those opportunities and that innovation and those assisted technologies beyond where you're working in the living lab? What sort of processes are you using in regards to that, so that you're going, beyond your lab, you're going into, further into other parts of Greece and then, globally?
Yeah, we at the moment we started obviously from approaching people through scientific events or other sort of key national events, etc., so that they become aware of our work. But then the essential work towards this achievement is done through the MOUs that we have. So we collaborate with a specific network of municipalities or specific patient associations. We try to show them the work. They become part of this activity as well. And of course, there is a lot of training. There is a lot of training activities and time that we devote in just taking them hand by hand, actually. If I can share one of my experiences, one of the municipalities which participated in a project back in 2012, we had listed them only as sort of active controls, the participants from that municipality. So 6 months or 8 months after the project finished, they came back to me and said, well, you promised us that we will use your services after the project ends. So what can we do? So it was a nice surprise for me that they came back to us with such a request. because it actually gave us the motivation to move forward even better in a faster way, and establishing it as a service that municipalities can use. So we gave them the service, we showed them the service again, and we tried to establish them in their facilities. Since 2014, they have been paying us for using the service from the municipality. But it's not only a matter of a commercial interchange, otherwise we would have been just a commercial company on doing this. Being in a university and therefore not considering the commercial benefit out of such an activity, but most important, the research and the societal impact, we try to get them involved, and so that they become research partners as well. So we taught them how to get data themselves, how to write about this data and analysis, and how to publish results and exploit this opportunity within the community. So basically, we established a small research hub within the municipality, and they consider themselves now partners in our research activities. And of course, this is also embraced by the mayor himself, but also because the political persons change every few years, the staff that is involved there. I mean, it's the people that use the services produced videos, and they handshake their appreciation to us, but also the members of staff that are involved there in constant communication with us, and they appreciate our support.
Great, thanks for that, Panos.
Fantastic. That was a really great elaboration on that. Thank you so much. Are there any other questions while we have Panos? Otherwise, I know that we're already pushing time, so if not, then we might move on to the next presentation. Great. Okay. Well, I think we'll move on to the next presentation. So thank you so much. That was two wonderful presentations so far.
Thank you. I'll pop out for a moment because I need to join in another meeting and come back later on and join again this meeting. Okay. Apologies for that, but I'll need to join this meeting.
Appreciate your time. Thank you.
Thanks, Panos.
Now it's Despina Manjari on social innovation, RRI, and how our lab embraces all these frameworks.
Hello, nice to meet you all. Thank you for this invitation. I will share my screen, and Maria presented in the first part of today's presentations a bunch of different activities we run with our people, and Professor Bomidis mentioned several different types of stakeholders, main actors of the regional local community here in Greece. We work with them for over a decade. But the question is how we keep these people engaged, why they do continuously working with us, and why it is so important to have them with us. It is the part of the social innovation and responsible research that Evdokimos mentioned. For us in the lab, there is a value. It is something that comes from the business sector that says that you may build the best solution, a very innovative solution, but if the society does not need it, it's just the best solution, but it's useless. So we try to keep all the different types of the quadruple helix: policymakers, citizens, the society, researchers, experts, and the industrial sector together in every step of our different project activities, so as to work with them, take requirements, feedback with them, and when you adapt the Living Lab methodology, you should also adapt this approach, the value of working and engaging different people in different activities. And this was for us in the past not an established engagement strategy, but an in-person effort of all of us in the lab, of Professor Bamidis, of course, and his colleagues who tried to build mutual trust step by step with policymakers, with local actors, with citizens, patients who came in the lab, tested, tried, piloted with us, and they couldn't, but they we didn't approach a specific strategy until some 3-4 years ago, when this community of people started to highly expand it. And it was an emergency for us to find the means to keep this community of people sustainable. And there are different pillars that we will try to pass through them in the next few minutes. The challenges or the key drivers, as we call them, they are both potential pains and gains when you try to engage people. And one of them is the resources. And resources means for us not only the money, the funding that you have in your hand in order to build activities and to engage people, to invite people to come and join in your research activities, but it is also the human resources, the people from the lab you have to engage in order to build a sustainable network and in order to host all these types of different activities that Maria presented. It is also the resources for organizing the events in all these different places, the museums, the university infrastructures that we use in most of our activities, and also Maria presented it in her presentation. So every time in our lab, we try to think first what we have in hand, and then with this in our minds, we try to build or follow the best scenario for designing the best possible activity or activities for our people. Another aspect we should also take into consideration every time we start a research project is that we need to work with all these different types of stakeholders, the representatives of the quadruple helix. And for us in the lab, as we represent the health and well-being domain, there is an extra barrier, an extra challenge that our main beneficiaries, older adults and chronic patients, are people who face different health problems. Their health conditions sometimes does not allow them to follow a journey from A to Z. So we have many people that they begin with their participation in a project, and then during the project may they face some health issues that are deterrents for their continuation in our efforts. So we try every time to build a concrete plan of their participation in the different projects, and also to find alternative strategies for their engagement. As Maria mentioned, we co-organize events both in the university and outside in the city, trying to engage policymakers, experts, citizens for finding solutions together. This is the biggest value in co-creation to achieve this pool, to have this pool of people and put them sitting together in the same table, discussing and finding together solutions. And as it has already been mentioned, we try to get to know them better, to approach them engaging from our side, from our lab, the best people, the most proper experts from our living lab, in order to investigate together with them their needs, their requirements, and what they want to do, what they imagine, what they envision when they participate with us in all these different types of projects. I will pass these slides because are just examples. It's a summary of what Maria presented. And the main secret sauce when working with all these people for all these years is that the mutual trust that we have achieved with them is that we try to be as transparent as possible from the beginning of our collaboration. We describe them, we have all the cards open, and we describe them every step of each procedure, their rights, their obligations when participating in our activities. We have people that are focused in this part of communicating with people. We have people who are engaged in the ethics and consent form design, the protocols, study protocols, so as everything to be ready and clear for all the parts, and to come to a mutual agree before starting its research initiative. This is something that we spent much time, but this is a necessary part of all of our procedures in the lab. The policy making, the engagement of policymakers is a special category of stakeholders and special type of engagement strategies that we follow in the lab. It is not just face-to-face meetings and invitations for policymakers to join our activities, but we try to make them also work with us and our people, our primary beneficiaries, in the same table again and again for every step of a research project, so as to understand the value and to want to continue this collaboration with us. This was how we achieved the collaboration with local municipalities and the regional authorities here in Greece. And after many years of holding such kind of events, of coaching, mentoring events, as well as seasonal events for bringing all these people together and strengthening the bonds among them, we have achieved these collaborations. But of course, the engagement is not only just to have people with us, but to have them for a long time of period. Many of our participants, especially older adults and chronic patients, follow us for many years, participates in more than one project. At the same time, they are willing to bring their relatives and friends in our community of stakeholders, so they are like ambassadors, they are real partners, as we call them. But the challenge for us is to keep them, to keep their interest alive, to keep them feeling like part of a biggest team, and to maintain their creativity and the sense of being active citizens for their peers and their society. The biggest value is for us in the last 4 years is that we have created this community of people, and I will pass it quickly so as to gain some time. And another aspect we we have focused in the last years is also the exit strategy. Of course, there is not always the things that are not always good. There is the failure aspect that is also always part of the game. Maybe some participants want to interrupt their collaboration with us. They do not want to participate in a project anymore, or they cannot, as we said that most of them have continuously different types of health issues to address. So what we try to do is to every time run the minimum activity with them. We try to collect feedback on likes and dislikes to find what went wrong, and to spend time to understand if their expectations were different of what we built for them. So we try to engage them and co-create with them even the events or the different types of the activities. And in these loops that we do from event to event, then we have many internal meetings as a team, and we discuss every time what went good and what went wrong, and try to improve ourselves so as to improve the impact for our community. We use quantitative and qualitative tools for measuring their impact. And this is a summary of the previous slide, so I will pass. From all these different means that we use, we try to find some KPIs. We have measured, we measure the impact for both stakeholders, but also for the lab. The stakeholders, the impact for stakeholders is summarized in a phrase, what is in for me, the value of participation in such kind of co-creation or other initiatives with us. And the impact for the Living Lab is the value for us, for the research work, but also for our collaboration and the sustainability of the community. And for this reason, last year, Evdokimos and Despina Petsani designed an online assessment tool that it is still under development, but it is something that we would like to explore more in the Vitalize project for measuring these KPIs and providing strategies depending on what kind of activities we have to build every time, or what kind of impact we want to achieve, both for us in the Living Lab and also for our stakeholders. This is a guideline that we have developed last year for the ENOL and the Visual Learning Lab. I think that it is available online. We can provide it to you. But it is not only the engagement pathway. We have also worked the last 3 years in the management of these people. As the community of our people is increasing, and this is a very important for us, we should find more sustainable ways of keeping this community organized and knowing every time which are the available stakeholders we can engage, in which type of activities we can engage them, to have continuous or very often communication with them, to avoid previous mistakes, etc. And we try to check which are the available tools outside in the market, but as most panel management tools are project orientated, and we wanted something that was more person orientated, so as to cover as an umbrella the different types of activities we run in the lab, we started to build our own tool. as until then we had piles of hard copied lists or Excel files of names, phones, email addresses of people, and it was a mess every time we tried to check in which projects we have engaged exactly which stakeholders. We have released a first prototype, which is functional, but our technical team is working on its improvement. So in the coming period, we would like to test them. And if you want to help us in this testing and provide us your feedback, this would be very, very important for us to work with you in this. I think that this was from my side. Thank you very much. I don't know if we have time for questions or...
I think if we don't have questions, there is one question, but how many stakeholders drop off early in the Living Lab process? What are the 3 critical approaches for stakeholders to keep being involved?
For the first half of the question, actually, we don't have many dropouts. This is quite good. The only reasons that it is their health condition that sometimes it's a problem for them to continue coming, but maybe the most often case is that they lose 1 or 2 events and they come again. So we do not count them as dropouts. And the second half was the 3 critical approaches for stake. For us, it's quite the secret sauce of the responsible research and innovation we try to apply. It is really important for them to feel that they are part of the process. They offer to their community. They're not just people that come and go every time we just need for them something. They are part of the community.
That was a fantastic presentation. Thank you so much. Really enjoyed that. There was a lot there as well. And yeah, being able to have such a engaged community over that long length of time, the tools you've come up with is I think a really great lesson for everyone. I know again that we're sort of running towards time. I think I understand we've got a presentation about the Vitalize component, which I know that will be of interest as well. I'm not sure who's running that.
Despina will present. So Despina will give also more.
The other Despina.
Pezzani will give more information on how living labs and external living labs and stakeholders and researchers can be engaged. So we kind of skip the overview and we dive in harmonization.
Lovely, thank you.
So hello all from my side. I'm the other Despina of the lab, Despina Pezzani, and I'm going to talk to you about the new project that is coordinated by Enol, and our lab is a very core partner, the Vitalize project, which is part of Horizon 2020. And in this project, a very central part that we are trying to implement is to create some common standards, procedures, and practices for all the living labs in the health and well-being domain to follow. So I think that it will be interesting also for you. What we are trying to do in this 3-year period of the project is to come up with a new standard, let's say, version. The standard is a very strict word, but it's actually some guidelines of how we run the services that are created from all the Living Labs community. And in its, from one standard version to the other, there is a cyclic process in which we implement the standard in Living Labs in order to test them, gather some feedback of and assess and evaluate what we have produced, improve them, and then go back to the standard version to submit it to the Harmonization Body. And the service and procedures that we would like to harmonize is about what the Living Labs can offer to the research. And already from the proposal writing, we have identified some steps that are used in the research process that are indicative, and we try to build on top of that in order to identify specific ideas there and harmonize what is going on inside that process. What is the challenge? The challenge is that the Living Labs are facing this whole procedure from multiple points of view. We have the business model of Living Labs, so how we can actually get money out of researchers for supporting them in their research. What are the research process phases? What are the innovation process phases? Because it's not only doing research, but launching into the market. How we handle the local ecosystem, how we make products out of our services. And each of this part can split into different some parts. So you understand that this becomes enormous and very interesting and important. And how we make sure that all this is meaningful for the Living Labs and has some value and is important, of high importance. We create the Harmonization Board and the Harmonization Body. The Harmonization Body is envisaged as a wider community of stakeholders that includes Living Labs, includes researchers, practitioners, and also parts of the healthcare and well-being system. And in this body, we would like to invite all the Living Labs that are out there in the health and well-being domain to contribute and participate in order to give their view and start creating something that is meaningful for all of us. And the Harmonization Body is a higher level body that is consisted of people that are experts in some domains of the Living Lab services and processes, and are the ones that will analyze the feedback gathered and the assessment that is done through the process testing, and at the end will produce, let's say, and will validate the standard version. What are our ongoing activities? We are currently where we are collecting data from the Living Labs inside the consortium in order to see what are the processes and procedures that we have in common and what are the differences that we have. And is indeed a very interesting approach because you learn your own Living Lab in a more structured way. And we are moving forward to the consolidation of the data gathered in order to go on with interviews about all this data that we have gathered, and then also run some online open co-creation sessions. So we start with the consortium partners because they are the most accessible ones, but we want to be open to all the Living Lab community and all together design what are the standards for Living Labs in order to have a first version in September and then move forward in this cyclic version. And towards the standard version 2, so after September, The plan is also to engage the need, which is the researchers, because as we said, we need to offer services and procedures to researchers, and they will be involved also in the whole process. So we want to combine these views of the offer, that is living labs, the need, that is researchers, but also other interested parties that may be policymakers and the industry. And we build on the openness. So we have the harmonization body, which is all the community, and we have the harmonized procedures that is going back to the harmonization body, and the harmonization body gives to that procedures with all the testing that they are doing, but also raw data, questionnaires, workshops that are open to all to analyze and use and refine. So how will this all implementation will run? This is a very difficult question that we are trying to answer, and we're working on defining this harmonization framework and this whole assessment process. So we are doing the first steps, but then we need to see how it's process, how we can validate that this process is defined well, is defined in a way that it can be used by living labs and is widely adopted. And in parallel on that harmonization procedure, we have the joint research activities that act as testing beds for this harmonized process. So we have the process that are defined and harmonized, and we try to test them in the joint research activities to make sure that they work and they can be implemented. As we said, the harmonization body is a wide body, so we are looking for crowdsourcing tools and workshops and small questionnaires to engage the whole community. And the harmonization board is the board of experts, so we will have more in-depth discussions, but also some engagement through Delphi methods maybe. And I would like to conclude with an open invitation to all of you for a workshop that we have tomorrow. It's 1 CST time, 1 to 3. We'll paste the link for getting the Zoom link in the chat when I finish the presentation. And this is about an open discussion of what I was talking about, of how we establish that evaluation process of our harmonized procedures. And also I invite you all to go to our website in the events. I will paste also the link, and click here so that you register in the Vitalize calendar and get information about our upcoming events and participate, because we are all a community of living labs and we want all together to build that and have a value from this. So thank you, and let's create together a common language that we can talk.
That was wonderful. Thank you so much. I know that we are a little bit over the time we'd originally allotted, so thank you to you and the team for wonderful presentations, and also for everyone who's been able to stay. I'm just wondering if just like to invite any questions that there might be about any of the presentations so far, and this opportunity in particular. Again, you can put up your hand, or virtually or in real life, assuming I can see everyone.
It's a lot to take in across those, the presentations, and there's a whole lot of it's really like I have to go back and probably go through it all again, have a look at the slides, have a look at what you've said. And I'd be really interested to be able to come back to you with some questions on what's been presented. But it's what I've enjoyed about them. It's more a comment rather than a question. Is that 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 the concept of the living lab and the use of the quadruple helix has really been used well within the context of what you're doing in the lab. And I think the other part of that is that the conversation around harmonization, I think, is a really interesting word. It really goes to the heart of living labs, which is, what we're trying to do is to create a body where we can all work together in some sort of equitable way that allows us to go from a problem into a solution and actually create a difference. And, I mean, this is my first introduction to the lab, so I really appreciate the time and the effort you put into the presentations. And I think, you've actually not only looked at the four components of a quadruple helix, but you've actually looked at all the detail of evaluation on all those particular levels, from stakeholder to delivery to medical versus clinical versus social indicators. So for me, there's a lot to unpack and understand, and I suppose that's the first thing. The second thing is I'm really interested in the evaluation tools and the way that you're evolving that over time. I think there's a lot of really interesting things that are happening within that, not only, and for me, it's really what are the questions that you're asking in the evaluation, and what are the impacts that help move us forward as a result of that evaluation. I think you've described it in terms of living labs and the ability to be able to share knowledge, and I know I talked about, what are the outcomes, and I think, Panos, you talked about the fact that, I think it was Panos, you talked about the fact that you actually had people that were now funding you to actually provide a service to them, and I think that's a really good way of getting the sustainable kind of business model there. And it's not necessarily a commercial aspect of the work that you do, but do you see yourself as, in any way, that some of the things that you are doing have potential for spin-off commercial applications? That's a general question, so I don't know who wants to actually.
Who'd like to take that question?
Or was the question not clear enough, or?
Do you just want to ask it again?
Yeah, so the question really is do you see any, I mean, while the Living Lab is about transfer of knowledge and about building capacity and sharing that knowledge, and from a research perspective continuing to grow knowledge, the other part of Living Labs is really, what are the opportunities for spin-off commercial projects or commercial opportunities that spin off out of the Living Lab as a result of the things that you're developing, and can you see anything that's happening at the moment that's likely to occur?
If I could, Desma, go ahead.
Okay, I would like to say that for the spin-off and the innovation is very central part, as we see it, of the Living Labs, and is actually what they are aiming at, and we do that in our lab as well. We have already established a spin-off of the university that came out from some research activities that we have. So they are embracing all the innovation process, and of course the actual target is to make money, let's say. So yes, the spin-off process is part of the Living Labs.
Okay, thanks.
If I could also add 2 bits here, and this is our understanding throughout involvement in Living Labs and the NOL community the last years, is that it's not clear for companies and spin-offs yet what the value of Living Labs. So if you tell a company that I will follow a co-creation methodology like it's done in NOL, it says kind of nothing to a company. This way we try now to harmonize, to exchange knowledge among all the Living Labs, etc., in order to find a way to strengthen our value, or to make our value concrete as Living Labs, in order then to be attractive from spin-off, from companies, and also from the private sector. So this is a challenge. This way also we started and we started working on harmonization.
Okay.
Because we do experience cases like for the research community, even our living lab is very attractive. So we have a lot of students from other universities or research centers to come and invite us to collaborate. But for the private sector, companies, etc., it's kind of difficult because they don't know the value yet. So this is something that we are working to increase awareness of the value in the private sector too.
Okay, thanks for that.
Thank you. I think that's very relevant for us as well. The harmonization, is an enabler of being able to work together. I mean, not only in Australia but internationally, but also that point you're making there about the private sector. I mean, the quadruple helix idea, even at a policy level, is fairly immature here. We don't have many of those kinds of policies. And for business to understand it, it's even further behind. So being able to explain the value propositions for living labs to business is a really important thing for us and for our lab sustainability.